the diagnosis and treatment of temporomandibular joint disease has basically been a consistent menage of smoke and mirrors applied to both the symptoms and the diagnosis and the attempts to treat symptoms of this problem. I've talked many times about the history, going all the way back to 1934 and Dr. James Costen, who first identified and wrote the first paper in the medical literature identifying most of the symptoms associated with TMD, temporomandibular joint disorder singularly, not plural. It's not a plural of disorders. It is a single disorder, which basically is inflammation within the temporomandibular joint. We'll talk about that a little bit more in a moment. Dr. Costen, 1934, from St. Louis, an ENT surgeon, wrote about the symptoms of headache, earache, and jaw pain associated with the temporomandibular joint. And he stated his opinion was that the syndrome of these symptoms were related to lack of support or lack of teeth in the posterior jaws, which created the symptoms themselves. It's the lack of teeth. Now, that was his opinion. It turned out to be not true, but that was the beginning of the attempt to describe symptoms, describe the problem itself, and hopefully come up with a solution. His solution was repair the lack of posterior teeth, which would then alleviate the symptoms and alleviate the problem. Well, again, that proved to not be true. But over the next decades, from 1934, 44, 54, 64, back in the early 60s, late 60s, the oral surgeons began taking a look at these symptoms to see if there was something surgically that could be done.